Welcome to our new chapter of discussion, whereby we will be discussing about the pathology of bones. And with me, I've created you slides that's based on bone tumors or neoplasias and other local conditions that affects the bone. Remember from my previous topics, I've been talking much and broad on the development of bones and the anatomies of bones. And still I have work to complete, whereby I'll be completing the work on the appendicular skeleton, which is the lower limb or the lower extremity. Then I'll finalize with the work of the axial skeleton. Remember, my channel is based on osteology, and osteology also brings in the topic of the pathologies of the issues that affects bone as well. Without much ado, let's consider the introduction part to bone tumors. We have tumors of the musculoskeletal system are an extremely heterogeneous group of neoplasms consisting of well greater than 200 benign types of neoplasms and approximately 90 malignant conditions. In this session, we'll majorly deal with bone-forming tumors and cartilage-forming tumors, and furthermore, we'll have some information on fibroblastic and fibrohistiocytic tumors. I've been telling you about the bone-forming cells and the cartilage-forming cells. Maybe I touch a little bit of it, but all this makes up a mature bone. And during bone development, just like any other tissue, bone is subjected to diseases or to pathology. And remember, whatever I've created today is just but a tip of broad information. And if you want to have the whole content, please subscribe and do a follow-up as well. So, like other systems in the body, musculoskeletal system develop tumors either as primary from those system itself or secondary from a distant primary location. Some tumors are benign while other are malignant. So this is trying to explain to us that musculoskeleton, since I've said it's a living tissue of the body, it's able to also as well get diseases just like any other system. And in particular, we have the tumors. And we've been told it can be either from the bone itself or it can be either from a distant cell. Primary bone tumors may be benign or malignant, since the cells of the skeleton system are derived from the mesoderm, and primary malignant bone tumors are called sarcomas. So we will check on them, we will understand what are the sarcomas and all those other forms of tumors which are brought to you right here. So tumors spreading secondary to bone are generally carcinomas of the breast, kidney, thyroid, and lungs. These tumors are called metastatic carcinomas because the tissue origin is ectoderm, so it's not part of the bone itself. We have the difference between benign and malignant tumors. We have the two tables here. The table on the left and the other table is on the right, which the left describes to us the benign tumors and their characteristic, while the table on the right side describes to us the malignant tumors types. So starting with the point number one, we have benign tumors are slow growing, while malignant tumors are rapidly growing. Then we have benign tumors are well circumscribed, while malignant tumors not well circumscribed, and maybe they may be irregular or they may present as other forms of shapes. We have benign tumors are non-invading, while malignant tumors are invading. Then we have other one, benign tumors are with or without symptoms, while malignant tumors are associated with pain and disability. We have benign tumors does not metastasize or spread, while malignant tumors metastases. Sorry for other spellings mistakes. X-rays shows lesion confined to the bone, while in malignant tumors we have X-rays shows ill-defined borders, mottled appearance, cortex may be broken as well. While benign tumors we have does not cause death of the patient, or it's not fatal, while malignant tumors, most of them may cause death of the patient. Remember, malignant tumors are the tumors that are advanced in nature. So these are just but brief of them, which describes the nature of benign and malignant tumors and their differences. So you can as well take your 2 seconds to review them, and if you need these notes, you can consider by texting me with inbox, so that I'll find a way to as well give you these detailed notes, but some introduction just to bone tumors. So let's consider the approach to the diagnosis to bone and soft tissue tumors from clinical, radiologic, and classification aspect of tumors. So as said earlier on, tumors are the bone diseases, and they present as other diseases of other tissues of the body. So when evaluating a new patient with possible tumor, the work up must commence or must start up with a careful and thorough history and physical examination before ordering any diagnostic studies. So this is essential to any physician or any clinician, any nurse, any doctor, any person who is a health officer should start over with history, then move ahead to physical examination just before doing any diagnostic study, is those of advanced lab test and any other test which may be required. So particular questions must be answered, and as well as an assessment of the physical characteristic of the mass in question. So these are the things which should be considered while undertaking or while trying to bring up the diagnosis of bone or soft tissue tumors under clinical or regular. Love, nimewest up some words, but never mind. Welcome to our new channel. Welcome to our new topic of discussion, whereby we will be touching on the pathology of bones. And with me, I've created slides that is majorly based on bone tumors, which will start up uh, our. Welcome to our new topic of discussion. It's new actually because it's not about the anatomy and the development of bones, which I've been explaining to you time to time. So with us today, I've created you slides that talks about the introduction to bone tumors or neoplasias and other local conditions that may as well affect the bone directly or indirectly. So remember to subscribe my channel and keep following up. And just in case of any question, there's the inbox down there. You can click and type your question. It will be answered as soon as possible. So without much ado, let's move ahead. Tumors of the musculoskeletal system are an extremely heterogeneous group of neoplasms, as consisting of well greater than 200 benign types of neoplasms and approximately 90 malignant conditions. So benign are the ones with the highest number, while moving to the malignant types are the ones with the lowest number, which bring us to the 290 respectively. For in this session, we will majorly deal with bone-forming tumors and cartilage-forming tumors. And furthermore, we'll have some information on fibroblastic and fibrohistiocytic tumors. I've also increased my favors or added my favors to you, that I've as well described the tumors that have metastasized from other tissues of the body, and as well I've been able to describe the soft tissues tumors that will as a result affect the bone itself, such as hemangioma and other ones like adamantinoma and so more, which will be able to take, or I'll be able to take you through. Remember, this is just a tip of a broad information, so you have a work to do, which is going through those heavy texts and get more informed about the tumors of bones. Like any other system in the body, musculoskeletal system develop tumors either as primary from those system itself, which is the bone, or secondary from a distant primary location. So this other line is trying to explain to us a tumor that metastasize from other location or spread from a distant location. So some tumor are benign. So welcome to our new topic of discussion, whereby we will be touching on the topic of pathology of bone. Remember, I've been presenting to you different slides explaining from introduction to bones, the embryonic development of bones, and to the growth of bone, and finally the anatomy of bones. And still I have some work to do so that I will be able to complete my work of a general description of the bone. Remember, osteology deals with the pathology of bone and as well the anatomy and whole description of bone. So with me, without much ado, let's consider the introduction part of bone tumors or neoplasias and other local conditions that affects bone. Tumors of musculoskeleton are extremely heterogeneous group of neoplasms that consists of well greater than 200 benign types of neoplasms and approximately 90 malignant conditions. So which means malignant are less than the benign types. So benign types are those tumors which are not much advanced. Okay, they're tumors, they're cell masses, their growth, and they don't present with that clinical features which will bring greater attention to the physician or to the patient himself or herself. While malignant types are those tumors that are advanced and they need advanced treatment plan or management. So for in this section, we'll majorly deal with bone-forming tumors and cartilage-forming tumors, and furthermore, we'll have some information on fibroblastic and fibrohistiocytic tumors. Remember, this is just a tip of broad information, and please do not forget to subscribe my channel for more information. And I've extended my favor to the dealing of tumors of other tissue or the tumors of distant tissues that will metastasize to bone and cause bone to have the appearance of tumor-like growth. So let's move ahead and check the introduction part, which continues to this other slide. Like other systems in the body, musculoskeletal system develop tumors either as primary from those system itself or secondary from a distant primary location. I've explained to you about that tumors of bone, and I've just said that musculoskeletal is a living tissue and it can be subjected to diseases just like any other system of the body. And we have the tumor can develop from the bone itself, or it can spread from a distant primary location or other tissue of the body. Some tumors are benign while others are malignant. That is well described. Primary bone tumors may be benign or malignant since the cells of the skeletal system are derived from the mesoderm. Primary malignant bone tumors are called sarcomas. So sarcomas must be underlined because we will be dealing and we will be talking about the sarcomas as we will keep moving down there to our next slides. So tumors spreading secondary to bone are generally carcinomas of breast, kidney, thyroid, and lung. These tumors are called metastatic carcinomas because the tissue origin is ectoderm. That's all about a brief explanation about bone tumors and their origin and their development, which we have the two types, the benign and the malignant bone tumor, which can cause bone to grow abnormally or develop uh, abnormally. So we have the difference between malignant and benign tumors. As said, the benign type is the tumor which is not much advanced or which cannot be given much attention as compared to the malignant tumors. So we have the different. With me on the the left side we have the benign tumors, while on the right side we have the malignant bone tumors. The difference are here. For benign tumors, we have they're slow growing, while malignant are rapidly growing. Benign tumors, we have well circumscribed. On the other side, malignant tumors, they're not well circumscribed. Then on the benign tumors, we have non-invading, and on malignant tumors, we have the invading. Benign type, we have they are with or without symptoms, or they may be they may not show that symptoms, which means asymptomatic. While on malignant type, we have associated with pain and disability. It does not metastasize, that is for benign tumors. While for malignant tumors, we have the metastasis. Then we have in benign tumors X-ray, or on the radiograph, we have the show lesion confined to bone, that is for benign. While on malignant tumors, we have X-ray shows ill-defined borders, can be mottled appearance, and cortex may be broken. On benign tumors, we have does not cause death of the patient, while malignant tumors may cause death of the patient. Though not all tumors of malignant form causes death of the patient, but remember, malignant is an advanced stage of tumor. Some people call it stage 3 of tumors, and yeah, we will consider that. We'll be talking on that on our classification or staging of tumors. So this just but information describing the difference between the two, benign and the malignant type. So you can take your 2 seconds to analyze on these two types of tumors. Let's move ahead to approach to the diagnosis to bone and soft tissue tumors from clinical, radiologic, and classification aspect. So I've told you that tumor is a disease of bone like any other tissues disease. So bring us to this side, we have how to approach and diagnose a patient with a bone tumor. So we will be moving like in other cases of disease, whereby we have to start from the history part of the patient, moving to the physical examination. Then we will be moving to more advanced level, whereby we will require to have some tests and some imaging maybe, and other forms of laboratory investigation. So when evaluating a patient with possible tumor, the workup must commence with a careful and a thorough history and physical examination. This is before ordering any diagnostic studies, and particularly questions must be answered, as well as an assessment of the physical characteristic of the mass in question. So we have the mass with us, or the patient has just come to you as a physician, or you as a clinician, or a doctor, or a nurse, or somebody of health profession order, and then you're starting getting suspicious about what's happening with the patient. So you have no reason to get suspicious or get worried. Just start over with the history. Maybe it could be a tumor, or it could not be a tumor, or it could be something else which has just disrupted the development of the whole structure of the human body, or a particular surface of human body. So we have you have to consider for the physical and history. Then moving ahead, you have to move ahead to pay attention on a mass or an outgrowth from a particular region of our body. So this will prevent the ordering of unnecessary tests and better enable the physician to determine which test will be helpful in diagnosing the condition and facilitating the therapeutic intervention if needed. Yeah. So after taking history and physical examination, the physician will be able now to determine which is the effective means of proceeding with this kind of maybe a mass which the patient or somebody has come with. So let's consider what's best to evaluate a patient with a mass. So there comes with us skin color, warmth, location, a swelling which may reflect a more aggressive process. Sorry for some spelling mistake. Neurovascular examination, joint range of motion, size, some mass has greater than 5 centimeter, and this will bring us to a point of suspiciousness. Maybe it's a malignant change from benign. And then we have tenderness, we have firmness. And for firmness, malignant tumors tend to be more firm on examination than the benign process. And the last but not least, we should consider the lymph nodes. So, which we are told that certain sarcomas, e.g., synovial sarcoma of synovial membrane, have increased rate of lymph nodes involvement. So, this is just but a summary of what a physician or a doctor or somebody else of health profession should consider when evaluating a patient presenting with a mass. So let's move ahead. We have the imaging studies, and for this, we'll start with the basic plain radiography. So initial evaluation should begin with plain radiography, irrespective of whether a bone or soft tissue lesion is suspected. Maybe some of us might have been rushing to advance imaging, like let's start with the CT so that we can be able to detect what kind of lesion or what kind of mass this could be. No, the best and the initial finding should start with a plain radiography, which will possibly even give us to the final diagnosis of certain tumors. And so, however, in more aggressive process, the diagnosis may be able to be determined on a plain radiographs, but further evaluation with advanced studies is usually indicated to determine the extent of local tissue involvement and assess the extent of disseminated diseases. So maybe there could be a primary disease of certain origin to a bone, so maybe it will need an advanced now studies. Now from plain radiograph, now we'll be moving down to more advanced like CT scan and MRIs and other forms of investigative regarding imaging of the tumor or any bone mass. So the initial radiographic images must be scrutinized because of the great deal of information can be gleaned from this simple imaging modality. Yeah, um, a broad information or as such a great information may be concluded from just a simple radiograph, either of a certain or a certain point of a bone. It could be bone of the scapula, which I've been talking about: scapula, clavicle, humerus, radius and ulnar, couple bones, yeah, or the phalanges of the tarsal, sorry, and what else? You can just remind me one bone, maybe, which we have been talking about, yeah. All those. So, with the conclusion, I was just trying to bring you to this, that at least try to read a radiograph in such a way that you could be able to determine what kind of lesion it could be before rushing to more advanced imaging modalities. So, in addition to evaluating lesions arising from the bone, one must inspect whether a mass arising from soft tissue is involving and possibly eroding the bone cortex. So, sometimes maybe the lesion could be from a muscle or ligaments or the tendons, which at a times keeps eroding the bone, or it may seem to be growing next to bone and could be confused with a tumor arising from bone. So this should be taken with much care so that not to miss the intended diagnosis. So radiographic features associated with benign and malignant tumors of bone. For benign, we have a well circumscribed, as said before. We have geographic and we have sclerosis. So these are the features which could be elicited from a radiograph showing a benign type of tumor. While in malignant, we could be able to read ill-defined, a loss of cortical integrity, a moth-eaten periostitis, and soft tissue mass. We will be talking about this as we will be moving down to more of specific tumors of bone. But just in brief, this is all that brings us to the summary of what we will be expecting in the reading of different tumors of bone. In evaluating lesions of the bone, the following key observation will allow a correct diagnosis to be made in the majority of cases. We have with us the first point being age of the patient. So certain tumors are relatively specific to certain age group, and such examples are Ewing sarcoma and simple bone cyst occur in children and young adults, while chondrosarcoma generally affect patients over 40 years. So maybe at some point this will be able, or it will enable us to narrow the diagnosis of some certain tumors. Like Ewing sarcoma said, you cannot expect Ewing sarcoma to be present in an old individual or adult, and this is a very rare. And other one, which is simple bone cyst, which is uh, predominantly in children, while chondrosarcoma generally affects patients over 40 years. So chondrosarcoma, this could be of cartilage form, but we will be able to check on it so that we'll have the positive side of our thoughts. So let's move. Single or multiple lesion. Most true primary bone tumors are solitary lesions, and the presence of multiple lesions suggests bone metastasis. So single or multiple. For single, bring us to the essence that these are benign. Well, it brings us to the conclusion that this just a small kind of tumor and it has originated from bone itself, which is a primary. While if we have more than one tumor occurring at different points of bone or different bones, then this will suspect that this has metastasized from certain tissue of the body. Site of the tumor, we have the bone involved and the site of involvement, whether epiphysis, diaphysis, sorry for the spelling, or metaphysis is important since certain tumors have particular direction for a particular bone and some occur mostly typically in certain part of the bone. We have the giant cell tumors are almost found in subarticular position IA epiphyseal location. So site of the tumor will bring or at least narrow your diagnosis to differential diagnosis, and maybe you could say it could be either a giant cell tumor which is probably present at a subarticular position, and it's not this other tumor, maybe osteoblastoma, that could be possibly found at the diaphysis of a long bone. So site of the tumor, it's very important to us that we will be able to identify tumor, narrow its diagnosis, and maybe prevent us from moving to more advanced level of investigation. We have else margin of the lesion. Slow-growing tumors have well-defined, sometimes sclerotic margins and are most likely to be benign. As said before, a well-defined margin suggests a benign tumor, while rapidly growing lesions will have ill-defined margins and appear to permeate diffusely into the surrounding bone, and this typically indicates a malignant process. So margin of the lesion, it's very important in narrowing our diagnosis or bring us to the diagnosis of tumor. Then we have the appearance of the matrix. And remember these things which I'm trying to bring to you are the radiographic features of a lesion. So appearance of the matrix, lesions of mainly cartilage tissue will tend to show areas of calcification, and a lesion from bone forming cells will tend to show areas of ossification. So these are the things to be discussed, which will be seeing them as we will be discussing particular lesions or tumors of the bone. So this is just but a summary. We have the diaphyseal location for tumor within a bone may facilitate a diagnosis. So for diaphyseal, we have Ewing sarcoma, we have osteofibrous dysplasia, we have adamantinoma, Langerhans cell histiocytosis. So I've not been able to find I've been not been able to find exact elaborate content to describe some of the tumors as Langerhans cell histiocytosis, but for the rest, we have them with us. We have lymphoma, we have metaphyseal, and then these are for diaphyseal. While we will be moving to eccentric, we have osteosarcoma, non-ossifying fibroma, osteochondroma, aneurysmal bone cyst, osteomyelitis. Sorry, for osteomyelitis is just infection to bones, but at some point it presents like tumors, and we will be able to learn when they are still available for differential diagnosis with some of the bone tumors. So osteomyelitis is just butt infections of bone. We have enchondroma, and we have chondrosarcoma. We have solitary bone cyst, osteomyelitis. Sorry for the repetition. And then for epiphyseal, we have giant cell tumor. We have chondroblastoma. We have osteomyelitis as well, which may appear both in eccentric and as well in epiphyseal. We have degenerative bone cyst. We have dysplasia epiphyseal hemimelica. We have pigmented venonodular synovitis. Those are the tumors which probably presents at particular regions of bone or specific parts of bones. We have as well the isotope scanning, and these are for only advanced level of tumors, which may be if a tumor has been missed from a radiograph or suspected, it could be this or that for differential diagnosis. Then a physician may decide to consider for more advanced investigative tests such as isotope scanning. And for us, we have the most common, which is the technetium, thallium, and fluorodeoxyglucose piston emission tomography, are the four major radioisotope scans that may be utilized in the workup of bone or soft tissue mass. So these are most isotopes that are utilized during the evaluation of soft tissue or bone mass. Technetium-99, which is widely used, are utilized to assess the degree of osteoblastic activity of a given lesion of bone. So this is just but a brief information as I told you, but you can as well dig deep into them so that you can find the exact information that can add advantage to your knowledge. We are progressing with the radiographic features. We have periosteal reaction. A thick, well-organized periosteal reaction implies a slow-growing lesion. An example is osteoid osteoma. This is a tumor of bone-forming cell, one of them. A periosteal reaction consisting of layers of thin periosteum implies rapid growth and is generally indicative of a rapidly growing malignant lesion. That's all about periosteal reaction. And remember, I told you about periosteum at the sites where these osteogenic cells are found. So which means if the osteogenic cells are there, then probably any lesion can as well appear. And this is the descriptive lines to describe how the periosteal reaction may appear for a lesion. Breach of cortex, we have destruction of cortex indicates an aggressive invasive lesion. Sorry for some spelling. Soft tissue mass, if present extension to soft tissues, is also evidence of a rapidly growing lesion. So that's just, but radiographic features and other physical features that are expected for some certain bone tumors, and that can narrow our diagnosis or may even at least bring us to the most basic part of which will aid in our diagnosis of tumors. Computed tomography and magnetic resonance imaging. These are the more advanced level of imaging modalities which are best indication for smaller lesions that can involve the cortical structures of bone, and for tumors involving the pelvis and sacrum. And it can help to elucidate the extent of bone involvement. So these are the modalities which can at most bring us now to the nature and the extent of certain tumors of bone. Then we have the MRI, the ones which I've been talking about is all about the CT scan. While that for MRI allows for excellent imaging in the longitudinal plane and as well as axial plane. I didn't explain about the planes of the body, but I'll try as much to find a way to as well bring you to these planes of the body and anatomical locations of the body. Meanwhile or meantime, you can just go through them, then you'll find how is the anatomy of the body described using this plane. We have laboratory studies, and the one starting over with it is the biopsy. Biopsies are slicing of a small tissue, either by, we'll be talking about them. What are the basic technique of taking biopsy? But biopsy is taking a small tissue or a piece of tissue for some laboratory investigation, slicing or doing some needle section or removal. So let's consider this, what's all about biopsy. In majority of cases, it is necessary to undertake a biopsy of material from the lesion for histological and bacteriological examination to reach a final definitive diagnosis. So this is where tissue is taken to the lab and brings us to the final diagnosis of the exact nature of the tumor. So the biopsy may be an open or a closed needle, or trephine may be used. Closed technique may be guided by CT scanning. So it's best done by CT scanning, not just local excision of tissue or just slicing away of tissue, as said before. That it was just kind of maybe to bring that clue of understanding of how biopsy is done. But generally, biopsy it's taking a tissue for bacteriological or histological examination, and this only done for bringing us to a final definitive diagnosis. So this where biopsy comes in, and we have the two aspects. We have the closed, which is done by needle or aspiration, and we as well have an open biopsy by incisional or excisional. So go find out more about biopsy of lesions or bones, which is basically done for histological purposes or bacteriological purposes. So adjuvant techniques, which brings us to our first introduction. So adjuvant techniques includes immunohistochemistry, cytogenetics, and molecular genetics. So these are very broad unit of which I felt like maybe let me just give you a few sample of how some bone tumors are able to be detected using this adjuvant technique. So this includes the blood tests and advanced investigation to reach the final diagnosis and treatment plan. To touch on a few using the principles of immunohistochemistry markers, we have osteoclastin is a useful marker of osteogenic sarcoma. This one of the bone tumor, and don't be worried and don't panic as well, because we'll talk much about these kinds of tumors. And we have this other one, S100 or S-100 protein is a useful marker for chondrosarcoma. So those or whatever I've been discussing to you, it was just but a brief introduction or a tip of an iceberg. I heard some English wise men talking of that, so we'll understand them and how they are applied on different bone tumors. So keep following up, because for every Tuesday night, I'll be discussing on bone tumors.